Hi there and welcome back. My name is June. Today I'm going to show you a demonstration of how to use an oral thermometer, how to use a tympanic thermometer, and then I'm going to go over an explanation of how to use an oxygen saturation or an Sp02 monitor. So in a second my patient is going to enter the room and we're going to begin our explanation and demonstration. Hi there. Well, I'm going to start with some hand hygiene in front of my patient, and then I'm going to say, hi there, my name is June. I'm going to be your nurse today. Can you please tell me your full name and your date of birth?
Jesse Moore, 67.
Great, and I'm going to just double check that on the armband and make sure I have the right patient to go along with my documentation. And so let's start with our oral thermometer. First we're going to take a temperature using this. This is a very common form of taking a patient's temperature. It has, I'm just going to get a little closer. As soon as you take the probe out, it turns on. It defaults to Fahrenheit up here in the top right corner. There's a little button that we just press right here, and that'll switch it to Celsius. We monitor in Celsius. There's a little man blinking in the left corner. His head is blinking. That tells me that I'm going to be taking an oral temperature, and that's important to know depending on where we're going to be taking that temperature, because there are degrees or varying degrees of difference between where we take a temperature, oral, axilla, or rectal. In the back you'll see a box of probes. This is an infection control measure. We always put a clean probe on to cover that metal part of the probe. Right there. Okay. Very simple to put on. We take the probe out of the machine and it turns on, and we push on a probe. Okay. Before I do that, I want to come back over here now and I'm going to ask my patient some questions that are really important for me to know as the nurse before I take the patient's temperature. For example, have you had anything hot or cold to drink in the last 30 minutes?
No.
Have you smoked?
No.
Chewed gum?
No.
What about exercise? Have you exercised in the last 30 to 60 minutes?
No.
Had any caffeine?
No.
Great. Those questions all help me determine whether or not I should see a difference or an elevation or a decrease in my patient's temperature. It's going to affect my patient's temperature. So you want them to not have had anything hot or cold to drink, or exercise, or caffeine or nicotine products. So next I'm going to explain to my patient, I'm going to go through the demonstration this time for real, and I'm going to document my findings, and I'm going to tell Jesse the results of our oral temperature. So Jesse, do you mind if I take your temperature with this oral thermometer? So I'm going to get a probe, and then I'm going to ask you to put this under your tongue, don't bite down, and close your lips around it, and just breathe through your nose, okay? Starting to just spin around. You can see a little circle spinning around there. Happens pretty quickly. 36.4 degrees Celsius is Jesse's temperature. Okay. So we never put our probes, any kind of garbage, on the table. We put it right directly into a garbage can or onto a tissue right away. That's another infection control measure that we do to not spread any types of infection or microbes. So that's oral. I'm going to put that right here, 36.4 degrees Celsius oral. I'm going to tell Jesse that that's a perfectly normal temperature. It's within the normal range, and we're going to move on to the tympanic. So a tympanic thermometer is considered to have many advantages and to be quite accurate because it's so close to the core of our body and gives us a really great reading in there. Of course, if your patient had trauma or injury to their ear, the tympanic thermometer might not be your best option. There are many different types of ways to take temperatures now. There are so many. There are ones you can point. There are strips you can actually stick on your patient's forehead. There's oral. There's a lot of different ways. I'm going to show you the tympanic next. Very straightforward to use as well. When you take it out of the case, it turns on automatically. It goes right to Celsius. It tells you how much battery life you have, and it tells you right there to apply a probe cover. So these are all little probe covers in here. We just reach the tympanic membrane device in. It makes a click. I advance over to my patient's ear, the one that I'm going to look at, and I'm going to take the pinna and I'm going to pull it up and out. That straightens the ear canal. I'm going to place the probe inside my patient's ear and press that button. And it starts to spin, and you instantly have a temperature, and that's 37. Actually a very normal, typical temperature. So that's very straightforward. There's a little blue trigger underneath the device. We just let that release into our tissue. And that's how you take a tympanic temperature. And I'm going to document that. And Jesse, that's also very normal. And I'm going to document that on my card, okay? So when I'm done with that, I'm going to perform some hand hygiene, and I'm going to immediately wipe my the devices that I've used. That is so important, this day and age especially, that we wipe everything that we've touched, every surface that we've touched. I'm just going to put that to the side. So next I'm going to move on to the oxygen saturation monitor. This is a great device. It's a great way of measuring oxygen saturation in our patient's body and using the periphery. And so it tells us how much good oxygenation is happening in our patient's body when they're taking breaths and filling their lungs with oxygen. That blood is getting oxygenated and it's getting all the way to the periphery. And when we put this on their finger or their ear or their toe, it tells us that there is perfusion and oxygenation right to the periphery. So it's a really important and useful device. It also tells us a heart rate. A heart rate is also a very important thing to be accurate about. And so I like to see you learn how to do a really good manual heart rate first in as many of the pulse points that you can find. And then to check your accuracy, you can use an Sp02 monitor. Or if you're in a hurry and you want to use an Sp02 monitor, that's useful too. We always wipe it off before we use it on our patient, and of course when we're done using it on our patient. So you wipe the inside part and the outside part, before and after. So the best number you can get for oxygen saturation is 100%. It's normal to see young, athletic, healthy individuals have 100%, but it's also really normal to see anywhere between 94, 95 and up. When you start to see an oxygen saturation below 92%, you should be concerned. It should never be below 92%. And a normal heart rate is between 50 and 100. So I'm just going to show you how this works, and then we're going to conclude. So I'm going to start by pressing a little button right there, and then I'm going to put it on my patient's finger. There should be no nail polish. It should be clean. And then I just ask my patient to take some nice breaths. You'll get a reading almost immediately. And this one has an alarm, and I'm just going to show the camera. It's showing me right now 95% and a heart rate of 50. And as my patient continues to take some nice breaths, you're going to see that number improve. So just nice big full breaths. That's how we know there's lots of oxygen in the blood. Big breaths. Big breaths, Jesse. And pulse going up a little bit, heart rate not too much, and I see the oxygen's getting ready to change again, so there we go. Okay? And that's really all there is to that. Okay, I'm going to shut that alarm off. I'm going to take a new alcohol wipe, and I'm going to just wipe that down to make sure that it is good and clean for the next person who's going to use that. I would document the oxygen saturation as 95% Sp02 on room air. Okay, and if you're concerned and it's below the normal range, try it on a couple of fingers on different hands. Try to get them to take some nice deep breaths and troubleshoot it that way as you start. And my heart rate was 53 BPM, beats per minute. So that's how that would be documented. And that was on right finger. So always be descriptive in your documentation so that the next person who's reading your documentation can understand what you've written. And that concludes our heart rate and oxygen saturation, but most importantly, our oral and tympanic thermometer. Thank you to Jessie, and great. Have a great day.